up here today. Would love to first start out, just want to introduce the audience to you. So tell us a bit about yourself and what your company is working on and the mission here. Victor, we'll start with you.
Absolutely. So Edamam is a nutrition data company. We organize and structure food and nutrition data, and we sell it to businesses around the world in the food, health, and wellness space. And ultimately, our goal is to help everybody on the planet eat better, live long, healthy lives. We think food is the ultimate medicine.
Thank you. Allison?
My name is Allison Duncan. I'm the CEO and founder of Anau Health. Anau is a company that is working to reimagine maternity care from the ground up. So in the existing climate with digital health and value-based care emerging as standards across the marketplace, what we've really understood is that maternity care fundamentally is broken in terms of how it's structured, and we need a structural solution. So working from the ground up to redesign how it would be delivered in an environment where providers are incentivized to have healthy pregnancies rather than just manage risk and interventions.
Thank you. Kavi?
Hi, I'm Kavi, the CEO and founder of Rose. Rose is a digital mental health platform that leverages deep tech for the early detection of depression and mood disorders. We do this in a combination of ways by leveraging an algorithm, a predictive modeling algorithm, where we gather data from the EHR and are able to find patients who may be at risk before they themselves even know that they're at risk. And then from that point, we would then take them through the continuum of care, allowing for a seamless journey so that they're not responsible for the burden of carrying their own care. And this is very important just given the fact that the population that we're serving is really vulnerable. And they don't have the time, or I would say the wherewithal, to call the back of their insurance card and get 20 numbers and cold call, cold email for a therapist. So Rose focuses on that individual and is able to get them the right care at the right time with the right person.
Thank you. And Richard?
Richard Hirsch. I'm the Chief Marketing Officer for UnaliWear, the makers of the Kinega watch, which is a unique, differentiating medical alert watch. We call it as I'm sure everyone out there who's still there calls it the I've fallen and I can't get up industry. Lots of stigmatization behind that industry, and we're the non-stigmatizing option. We are the only ones that offer a watch with built-in fall detection. No one else out there does that. You have to get a pendant normally to do that, which creates its own problems. And the additional thing is that this device or this system, any system, is only good if you wear it. And the daily average use in this industry is abysmal. It's about 30%. Our wearers, most of them never take their watch off. The daily average use for us is 86% and growing. And it's because the watch also has a built-in rechargeable battery system. So you never take the watch off to charge. And so we grew 457% last year. Our consumer acquisition costs are 30% of the competition. So we have a really good product market fit, really happy customers, and most importantly, we're a mission-based company. So we're saving lives every day and allowing people to stay in their homes and live independently, and that's incredible peace of mind for themselves and for their loved ones.
Thank you. And Kavi, would love to hear from you. You mentioned something of you're really working with these vulnerable populations, particularly throughout the pandemic, which I think added even more layers to that. What have you kind of seen as the biggest impact at Rose that has taken place the last 2 years?
Sure. So what we are seeing now in this space is that about 85% of all mental health care is being treated or is treated in the primary care setting, yet less than 10% of these clinicians feel like they have the acumen or the resources to treat these patients, but yet 75% of all antidepressants are prescribed in the primary care setting. So this tells a very interesting story that there are vast behavioral health deserts out there, which practically I would say every city now is in a behavioral health desert. And you're really relying on the primary care doc to provide care, and they tend to be the first and only line of defense when it comes to mental health care. And all they really can do is just prescribe a medication and then tell you to call back for your insurance card. So that's exactly what we've been able to tackle during the pandemic, because once that patient goes in and they're able to get the prescription, 80% of them actually just drop out of the continuum of care. And that's where Rose kind of comes in, because we're able to augment the care for the clinicians so they can better identify patients, have early identification of depression and mood disorders, and then further give the patients a suite of solutions that empowers them, that allows them to not just use it for self-help, but to also identify triggers within themselves and be able to at least have something rather than nothing.
Thank you. And Victor, would love to hear from you. Your story as a founder, I know it well, and maybe kind of give the background for the audience. But as a founder in this space and navigating not only the last 2 years, but years and years as an entrepreneur, from kind of this point moving forward, what do you see as the biggest opportunities ahead for entrepreneurs, particularly in healthcare?
Oh God, so not Edamam, just entrepreneurs in healthcare. Look,
Based on your experience.
it's the bright new future. I mean, we are just at the very beginning of what the potential change can be, both in terms of how health and healthcare are structured. I firmly believe that preventative health is going to be the way of the future, and that if we succeed in what we do, all of us here, there'll be no hospitals. There'll be no needs for doctors. Everybody will be managed from the day we're born in the way that they are healthy. And yes, there'll be acute accidents and all kinds of things that people might need to see a doctor. But the chronic conditions that we're all talking about, the maternity or behavior, telehealth or falls for old people, those will be things that preventively be managed. So I think there's a lot of work to be done, and I think the entrepreneurs have a lot of value to create. So I'm personally very excited about the future.
And as the founder of Edamam and what you're working on in the nutritional space, have you seen, have things gotten easier with the pandemic, harder? What have kind of been some of the biggest takeaways and lessons learned there?
Yeah, I mean, we're part of the rising tide. You know, we're in the right place. The big wave's coming. We just have to paddle fast enough to catch it and then surf all the way to the coast. But the reality is that the pandemic accelerated a little bit that. I mean, people become a lot more mindful of, damn, my immunity is compromised, and that goes back to food. And suddenly there was a lot of interest, what are the right food to eat? How do I support my immune system? So on and so forth. That's all trickled down. It used to be a lot more kind of, here and there, companies care about it, individuals care about it. Now it's become part of the parlance and of the discussion across the healthcare industry, whether it's insurance companies, corporate wellness programs, population health companies, even pharma companies. They're all thinking food and nutrition as preventative medicine. So I see a big momentum happening. There's a lot to be done. We still have an antiquated system where measures calories, which are very inaccurate, and we care about macronutrients, which are not very good predictors of health. But there's a lot of good signs that's coming with microbiome, inflammation, and so on and so forth. And I think one day we'll have truly delicious, awesome food for everyone that keeps them healthy and happy.
Thank you. And Allison, you mentioned that the current model focused on maternal care just isn't working. Would love to hear a bit more about that, particularly as it relates to when you're speaking to an audience in healthcare, so they have some level of background. Sure. What are things that, one or two things that you think could be the most transformational in terms of increasing their understanding of what the problem is here?
Okay. So I think one of the things is that how risk is managed in the maternity setting. So the first thing that a woman does on her pregnancy journey is usually call her OBGYN, right? And you go into prenatal care and look for risk to evolve, and then when risk evolves, there's more clinical care provided. but she's often left without the information that she needs around what creates a healthy pregnancy. She's not integrated into a community setting where she can make choices about what's the best birth setting for her. And often birth setting is not even a conversation that happens as part of the pregnancy journey in the OBGYN environment. So there's been quite a lot of research that shows that there are healthier pregnancies when women have access and the option to a birth center or a community birth setting. The pandemic has actually also raised the consciousness of women as they go through that, say, I don't really want to go to a hospital right now, or I actually don't want to go sit into the doctor's office. I'm healthy. Why do I want to expose myself to a doctor's office right now while I'm pregnant and may catch COVID? Or why do I actually want to go into a hospital to give birth when there's all these people in the hospital who have COVID? Strangely enough, though, if you look at like some of the surveys of moms who have, after having a hospital birth, are asked whether or not they're satisfied with their experience in the hospital, 40% in California say that they are not. Often they don't know that they ask, isn't there another place that's not a hospital that you can actually give birth? I think I would prefer to go there, right? So I think that, you know, what we imagine is a time when women are the protagonist of their pregnancy journey, that they're in charge, that they actually have, that the care provider network is a group of people who are skilled at helping women leverage the most motivational time in their life to adopt healthy behaviors, to understand how they can make those changes, and then they can also understand from a culturally relevant way where and how they want to give birth. And that there's enough connective tissue to support them if the risk does evolve and they need an acute care setting. But not to see the hospital as the standard of care, but actually the acute care environment, and to move support outside of the clinical environment.
Yeah, I think, I mean, that's the thread here of the whole person care, the preventative side of things,
Yeah.
And getting it ahead of it. Richard, would love to hear the growth from UnaliWear in the last few quarters, and I feel like I'm often getting emails hearing about you guys' incredible growth. What do you think, is it one thing you can attribute that to? What do you think has been the biggest value drivers over the last year for UnaliWear and the growth you've seen?
Well, so a couple of things. One is just to set the table. There's about 4.5 million people in this country that have a medical alert device, and yet there are 55 more million or 56 million more seniors who don't have one, mostly because, and there are a lot of reasons, mostly because of stigmatization. So, you know, there's a huge market out there for a company that can destigmatize this very important device, life-saving and lifestyle-saving device. Now, to answer your question, I think a lot of it has really been the network effect. You know, we've been in business now for about 3 years, and we're starting to see that hockey stick because we're getting a lot of calls from people that have seen our literature or that have, you know, their doctor had it and their doctor told them to call us, or their friend had it in their church group and suddenly they want it. And so there's a lot happening there. We also do I mean, it's getting into the weeds, so forgive me for 1 second, but we also do a customer referral program where we give a benefit to the customer and a benefit to the new customer if the new customer says that they were referred by the current customer, current wearer. We call them wearers. We have people that haven't paid for their Kanego watch for like 1.5 years. Now, we don't want them going up and down the street with a sandwich board and a bell, you know, but they're really actively involved. And so I think the network effect is really powerful. And lastly, if you go to our website and you fill out a lead form, we're the only company in the industry where you can check a box that says, I'd like to speak to a current wearer. And this came from our wearers who said, hey, you know, we want to talk to people that are going through this journey, and we want to help them in a way that we struggled with. We want them to explain to them, if they're interested in your product, we'd rather you have them talk to us versus talking to a salesperson. And no one in the industry does this, and it's a huge benefit for us, and it is incredible from both the network effect and just from our overall brand credibility. You can't buy this. And so we're in a very, we're humbly in a very honorable position with our wearers.
Yeah, I think that the patient connection is so important there. And now moving forward and what's ahead for you guys, what is your biggest kind of ask, or if you could, speak to anyone in the audience today, what's one thing you'd really want to tell them or ask of them?
We want money. Working capital.
Yeah.
We literally are selling everything we make. And so, and this is all right now, it's all direct to consumer. We're probably the only direct to consumer company, or one of the few probably, in this entire show. There's lots of people going B2B, and that's a great place, and healthcare is wonderful, and there's tremendous opportunity. But we started out as DTC, and we're going to move over to B2B. And so finding the right additional investors who see the fact that we're killing it right now with limited resources. We, again, I'm not getting into a sales pitch here. We cut our budget, our marketing budget by 1/3, and we grew 40% in the past 2 months. Like, we're just not, it's all happening well beyond the normal marketing funnel you build trying to attract customers. And we consider ourselves very blessed, and we're trying to honor that blessing by being true to our customers and true to our investors and everyone else. And so we're just looking for other people out there, other investors out there who can see the value and can help us both continue to grow the DTC side and continue to then transition over to healthcare. And with that, on the healthcare side, we think there's a real opportunity for remote patient monitoring, where this becomes the hub in the house, the brain that collects, because it's Bluetooth enabled, the brain that collects all the data and can shoot it up to the cloud and have a remote nurse triage that for hundreds, if not thousands, of patients in a much more efficient way than doing in-person visits.
And Kavi, what do you, as focusing on the mental health side, and I think there's a whole need for integration across the system. Mental health can and should be a kind of foundational part of how we care for everyone. What do you see as the biggest challenges moving forward, or your biggest asks as you're working to collaborate with partners in terms of how to work on the integrated approach?
Sure. So I think our competitor is really the status quo, and there just aren't enough people to serve those that are in need. This is a problem that can only be solved through technology and scalable technology. Unfortunately, we'd love to throw bodies at this problem, but there just aren't enough bodies to throw at it. So what I'd like to get across to investors, and I would echo Victor's sentiments as well, is to take a look at the way that we are now transforming how mental health is being delivered by being able to focus on early detection, leveraging predictive modeling so we can see patients who are at risk, and then be in a position where we can, we've partnered with a care coordination company that we white label, and now any patient on our platform can click a button on our app, and in less than 30 seconds, they have access to a licensed clinical social worker 24/7, 365. And I think that's really where the deeper tech that meets the deeper science and meets the human capital, that would fundamentally just change the way mental health care is delivered.
Thank you. And as we're wrapping up here, would love to hear from each of you when you think out 20 years from now. And I ask this question to every single founder we're interviewing and considering bringing into StartUpHealth. It's one of the most important questions that I want to learn more about. So would love to hear from each of you. Your blue sky vision, how is the world different in 20 years because of what you've done? Victor, how's the world different because Edamam exists?
Yeah, I've painted that picture before, but I imagine a world where you have a virtual nutritionist that lives in the cloud. It might be on your wrist as a watch, it might be on your refrigerator, in your smart car, wherever it is, and it knows because of technology what you had for dinner, what your real blood chemistry is, what your significant other likes, what are the allergens of your kids, what you have in your refrigerator, and able in real time, non-intrusively, to suggest to you what you should be eating that is delicious and you enjoy. Things like you walk in from a lunch, from a meeting in the morning and it's lunchtime, and we say, hey, 2 streets from here, there's restaurants with those 3 dishes that perfectly fit what you had for breakfast, and you like them because this is your taste, and this is the pricing, and you can get it. Or you're driving back home from work, and it'll be questioned: do you want to order in or you want to cook? If you want to cook, this is the 3 ingredients in your refrigerator. We'll send you a drone with the other 2 and the recipe, and we'll get the robot starting to chop the onions and whatnot. So when you get home, you can prepare your meal. This is all data. And that's what we're building. We're building the data platform to enable that future of seamless virtual nutrition where you're just enjoying your life and don't get sick.
So next time we do a panel, we'll all know right after where to go to eat.
Absolutely, that's the goal.
And Allison?
Yeah, so I imagine a world where every woman has the ability, every birthing person has the ability to get access to culturally relevant, community-based maternity care. And the way I imagine that is, I grew up in South Carolina, born and raised in South Carolina, but I live in California and spend a lot of time in Washington State. Washington State's preterm birth numbers are rated A. South Carolina is D- and falling. And it makes no sense that the preterm birth numbers in South Carolina are as abysmal as what they are. And so I think that we need total structural and cultural change in birth culture in our country. And I would like to be a part of making that happen in my home state. I would like to see it's fractured. The trend for certificates of need and building more NICUs and more hospitals is moving in one direction. That's actually making it difficult to build community-based birth settings, right? So for me, I'd love to see South Carolina rated A and have the story for transformation for the rest of the country that tells us why that happened and how we can scale it up across the rest of the states.
I look forward to that.
Yeah.
Kavi, what's your 20-year vision?
Definitely, Rose will be a leader in the mental health space, and we will work to end so much sadness that currently exists. The way we will continue to do this is just further enhancing our deep tech and our algorithms so that we can detect when patients are going through or about to go through burnout, for example, and look at other ways of detecting biomarkers, such as being able to leverage speech and audio to detect depression and mood disorders, as well as looking at video recognition of microfacial expressions that can show the entire musculoskeletal aspects, so we know if someone's going through pain or substance abuse. But it's really focusing on a tech-enabled solution that would allow for less providers and services and solutions that can help with the Rose platform.
And Richard, to quickly wrap us up, what's your long-term vision?
Destigmatization. People shouldn't be ashamed to wear a device that protects them and gives their loved ones peace of mind, keeps them safe, keeps them in their home, prevents them from having a long hospital stay, changing their life in an instant. People shouldn't be stigmatized for doing that. And the industry stigmatizes people just by nature of the form factor of the offering. And it's shameful and it's wrong, and we're going to change it.
Amazing. Well, thank you all. That brings us to a close here today. And for everyone, we'll be back here at 11 a.m. tomorrow, and we look forward to seeing you all at the Startup Health Pavilion. Thank you.